Hi, y'all. 9 postpartum warning signs. 9 postpartum warning signs. I usually talk about 5 things. Today I'm going to do 9 because I couldn't get away with it, but it's important, so hang with me. I am Dr. Fatou Forna. I am an OBGYN who works to keep pregnant women safe here in the US and around the world. So, most of our maternal deaths happen in the postpartum period, the period after you've had your baby. About 52% of all maternal deaths happen after delivery. So it's important that we pay attention to postpartum warning signs, and we know when to, call for help. What are warning signs in those first few days and weeks that we need to ask for help for to make sure everything's okay. The Association of Women's Health Obstetric and Neonatal Nurses, it's called A1, they came up with a really good algorithm, a really good list of postpartum warning signs. And they use the acronym POST-BIRTH, P-O-S-T and B-I-R-T-H. That's why I'm doing 9 things today, because A1 gave us something good that we should all be aware of. You should call 911 when there's anything in the post category, the P-O-S-T. You should call your doctor if there's anything in the birth, the B-I-R-T-H category. So let's start with the ones that you call 911 for, the emergency ones, P-O-S-T. So P stands for pain in your chest. So if you're pregnant, if you're postpartum, and you start having pain in your chest all of a sudden, that is a 911 thing. It could mean that you're having a heart attack. It could mean that you're getting blood clots in your lungs. Those are things that can kill you very quickly. That's why we recommend you calling 911. So the O stands for obstructed breathing or shortness of breath, difficulty breathing. Again, difficulty breathing could mean, it could be a sign of a heart attack. It could be a sign of those blood clots in your lungs. But problems breathing, I can't breathe, I'm short of breath. That's a 911 call. So that's O, obstructed breathing. The S in post is for seizures. If you or your loved one starts having seizures and they've just had a baby, there's something called eclampsia that can happen when you have preeclampsia and your blood pressure shoot up. It can lead to eclampsia where you have seizures, and that is life-threatening. Women can die from that. So pregnant women having seizures, call 911. And then finally, T in the post, P-O-S-T, is thoughts of hurting yourself or your baby. All right, that can be a sign of depression, postpartum psychosis. Pregnant women, after they've had their baby, there's a lot of hormone changes. About 80% of women have the blues, which can be kind of a mild form of depression, but about 20% can have real depression. And sometimes you can even have thoughts of harming yourself, committing suicide, or thoughts of hurting the baby. So if you have those thoughts, call 911 and we can help you. So for post, you call 911. Let's talk about things you call your doctor for. Birth, B-I-R-T-H. If you have any of these things, call your doctor and they'll let you know what to do. So B is for bleeding. If you start bleeding very heavily, more than 1 pad an hour, you're changing a pad like that, that's not normal. You start passing big clots, bigger than the size of an egg. That's not normal. That could be a sign of postpartum hemorrhage, which can be delayed. It can be a week after you've had the baby and this starts happening. So if any of that happens, heavy bleeding, you call your doctor. Birth. The I in birth is for your incision not healing. Your incision, your wound. If you had a C-section, if you had a laceration or an episiotomy that they stitched up in your bottom, in your vulva area, that's not healing. It could be a sign of a wound infection. If it's warm, it's swollen, it's draining, it has a foul odor, call your doctor to check it out. All right, the R in birth is for red. If you have a swollen or a painful leg, especially if it's just one leg, not the other, it can mean that you have a blood clot in your leg. We call it DVT or deep vein thrombosis. Those blood clots They can break off and go to your lungs and cause a pulmonary embolism or blood clot in your lungs that you can die of. Big cause of death after you've had a baby, because pregnant women are at high risk of forming those blood clots. So if your leg starts being red, swollen, or painful, call your doctor immediately. All right. The T in birth is for temperature. If you have a fever, if you have a temperature 100.4 degrees Fahrenheit or higher, it could be a sign of infection. Infection is one of those things that can kill pregnant women very quickly. So if you have a fever, you call your doctor. We need to see you if you have a fever. All right. And then the H in birth is for headache. If you have a persistent headache, you took Tylenol, it's not going away. It's one of the really bad headache. You have vision changes. Those could all be signs of preeclampsia. That condition where your blood pressure goes up can happen during pregnancy. It happens a lot postpartum after you've had the baby. So if any of those things are happening, call your doctor. I had talked before about getting a blood pressure machine. Check your blood pressure, but definitely call your doctor. All right? So Black women, pay attention to these post-birth warning signs. These warning signs after delivering the postpartum period, and seek help immediately if you have them, because we need you to survive and thrive.